In my practice, I deal with biological dentists very closely because unfortunately, every week I receive anywhere from 2 to 8 calls a week of a new cancer person diagnosis. So in taking them through all the emotional component and the anger and what led them there, and then asking another question when you're faced with a condition that's catastrophic like that, I used to ask patients, do you want to live, when they worked in my office. I have a dear friend, she said, no, ask them, when did they decide they wanted to die? Because when you decide you wanted to die is when the body starts breaking down. So you have to be very careful with your thoughts and your words. But when we talk about the mouth, people are not even aware you have more parasites in your gums than you do in your colon. There's a couple of dentists that I know that will swab your mouth before he will touch you and show you under a microscope all these parasites. There's another dentist, Dr. Hal Huggins, that also will do DNA testing of your gums. He said 99.9% of all breast cancers are coming from the gums. Now, another friend of mine who's a biological dentist have done biopsy of the gum tissue and has shown the same tissue in the fibroid tumors. So if you have unhealthy gums, unhealthy mouth, there is a major, major problem. And we know about the eye tooth, but people don't know about the tooth going to your spine, the tooth going to your spleen, the tooth going to your thyroid, all these problems. You weren't even aware that when they put the mercury in our mouths, that how that was going to affect your thyroid. We didn't even deal with endocrinologists and have thyroid disorders until they started putting the mercury in our mouths. We didn't wear glasses as children until we started getting the mercury. There's a website on YouTube, it's called The Smoking Gun. You can go to that site and you can see the vapor of mercury coming from your mouth if you had any mercury fillings. And, you know, while we're on the mouth part, I tell people, I said I'm going to have to get a website for it, and I call it the kissing parasite, which is H. pylori. And a couple of doctors, they were like, oh no, that's not true. I said, well, why is it? Now the Mayo Clinic does have it on their website. But if we could do a blood test, stool test, and a vapor test, blowing into a machine to find H. pylori, then why is it it's not going to be passed through kissing? So research shows now that it does. That organism, I'm telling you, if you have burping symptoms or problems in your upper stomach, you know, I advise everyone, just tell your doctor, please do the blood test on H. pylori or stool, because it's an easy way you can help prevent this from going catastrophic, because every colon, every stomach cancer patient I've had, they all had positive for H. pylori. So what came first, the chicken or the egg? But hey, I want to know. You know, this is your body, your life. Be very proactive. So back to the mouth. I had so many situations, and I started with tooth-organ relationships about 25 years ago from a colleague of mine in Arizona. I went to one of his seminars and met a patient who had liver cancer. And he also had a cap, he also had a filling there, and he also had a root canal. And while I'm on root canals, please purchase this book. It's called The Root of Diseases. And the other is the root canal cover-up. Because your dentist is not telling you. And a lot of our health is coming from our teeth, especially cancer conditions. Now, what happened with this gentleman? He went in for a root canal, doctor put a cap. Now the tooth going to the liver, the tooth meridian, when they remove your root, a mainstream doctor, they only remove so much. The rest of it becomes gangrene going to that organ. So that organ is going to become ill. You're going to have a problem with it. Sometimes some people it's 10 years, sometimes it's less, depending on what kind of filling they put in your mouth. One of my patients, she, in her early 20s, went in for a root canal. The doctor put a filling in. He put mercury after doing a root canal. She has the worst case of MS I've ever seen. She is bedridden. at such an early age, and because it just shocked her whole system. So peripheral vascular diseases, people having pains in their hands and feet, I'm telling you, if you had a root canal with any mercury, check into that. But I always tell people, this is part of my practice now. That's the next step after seeing me is to see the biological dentist. So the doctor went in and told this patient, go to your dentist, tell him to remove the cap, and not just remove the cap, but clean it all out, all the way to the bone, so that you could start to heal from this root canal that was not thorough. And his dentist said, I'm not going to touch it. I'm just not going to touch it. I did an x-ray, your x-ray is normal, I'm not going to do anything. So he said, well look, you know, don't put it on my insurance, I'll pay you cash. Then the dentist said, okay, I'll do that. You know, I'll do it for you. So he said, you know, more or less, bring on your clonies, bring your doctor and all these people who keep telling you this is a problem, this is a problem. And I want you to see when I pull this cap off, there is nothing wrong with that tooth. So as soon as he pulled off that cap, the odor was so foul that everybody had to leave the room and catch their breath and then come back. Once they cleaned that out, that root all the way to the bone, this gentleman went into remission from his liver cancer, and he's still doing fine. The same thing happened with a lady with breast cancer. She was sitting in her doctor's chair. She still had the pain. I sent her to the doctor. I said, go to this person, tell them to do the cavitation. As they were finished the cavitation, even before he did her suturing, the pain was gone in her breast, and it never came back. And the healing process, person with a tumor on their spine, he was from Germany. He said, no, I went to the best doctors in Germany. I said, okay. I don't know how this happened to me. I don't drink, smoke, great diet, exercise, not overweight. I don't know how this happened to me. I said, I can tell you. You had a root canal, didn't you? He said, how did you know that? I said, because that's what happened. So I brought him to my office. I did a test on him and showed him his thoracic spine, 11-12, where the tumor was sitting. It's the same tooth that he also had the root canal. So once he took care of that, he came in a wheelchair. Once he took care of that, his healing journey became much more aggressive, and this guy was swimming, taking his kids to Disneyland, having a good time. It's all about having a great quality of life. That's my number one prayer with my practice, if people have a great quality of life. So we do everything, the emotional, the spiritual, the nutritional. It's like peeling an onion and getting to the core so we can get the body to heal. And you might come in with a disease label, but we're definitely going to go to the area and find out why this is happening. There's something that I always say, and I am so grateful that I'm a magnet for miracles. And I'm telling you, I say that before I do business with people. Just giving Yahweh, giving God all the praise before I do anything.
A man who faints in the midst of adversity, right, will spit this week. Does that man look weak? Is anybody feeling anything weak? Are you feeling strong and mighty? Mighty, strong, bold, and courageous? Are you feeling like Yahweh? The Lion of Yahweh. The Lion of Judah. Are you feeling like Yahweh?